That's true.
Now, what do you think about median incomes?
Well, you know, the median incomes, including Social Security and retirement fund receipts, has not risen in years. The Americans have a high average debt, and some have incurred extra debt while caring for their own aging parents. So if they're counting on family members to care for them too, they may be very disappointed because the families may be too small or too far flung.
Exactly, Carolyn. And there's 34.2 million people that provide unpaid care to those of 50 or older. That's about 95% family. The cost is $500 billion annually. And that's been the backbone of the nation's long-term care system. That $500 billion worth of free care annually is 3 times Medicaid's professional long-term care spending, and what, of course, that's helping keeping people out of costly institutions.
But you know, Freeman, the supply of caregivers is shrinking just when we need them the most. Every day, 10,000 people turn 65.
Exactly.
And in 2020, and there will be 56 million people 65 and older, up from 40 million in 2010. So,
yeah, but meanwhile, we have the ratio of caregivers to care recipients. Now that peaked in 2010 and has been on a decline over the last 8 years, in large part because of changing family dynamics.
Well, that's true.
Well, what do you have to say about that?
Because families have fewer children. You know, you were an only trying to do all this.
Exactly.
And families in general have fewer children. Then you have the older adults, those who have never married, or are divorced, or they have adult children who live far from their parents, so they're too far to care for their parents because they may be caring for one of their adult children.
Exactly. We said that at the outset. It's the squeeze or the sandwich. We have aging parents. We've got to take care of our finances, their finances, and if we have dependent adult children, we still have to consider the fact that we have to take care of their finances as well. Now we know that the private sector, that's not much of an option for many adults.
No.
The demand for private home health aides is expected to exceed supply by more than $3 million in the next decade.
You mean 3 million people?
I'm sorry, correction. Must be thinking about the cost of my mistake there. But many can't afford it, even if it's available. Your average health aid, the cost of having that health aid in your home is $49,000. The public support hasn't kept pace either. What do you think about Medicare and other government programs?
Well, you know, Medicare and other government programs only provide a fraction of the long-term supportive services that people need to stay in their own homes.
Exactly. And go ahead.
Yeah, and Medicare usually does it does not pay for long-term care stays in nursing homes, which can cost up to $100,000 a year.
Yeah, just like in the metropolitan area, $137,000 per. Carolyn, the average stay in a nursing home facility is 2.9 years. Now you're talking $400,000 approximately, just for a 3-year stay. Now, after the person has spent down the resources like bank accounts and stocks, how does Medicaid fall into place?
Well, you know, Medicaid is a needs-based state and federal program.
Right.
And it will pay for most of the nursing home costs, but coverage and eligibility vary from state to state.
I would recommend long-term care, skilled care. What it does, it preserves your assets and your dignity. You need a plan to pay for long-term care services. The plan that protects the assets that you've accumulated over a lifetime from the ravages of long-term care expenditures and cost. I also would recommend a good solid annuity as well as life insurance, because now there's various companies that offer riders for critical care. Some long-term care companies might not provide the insurance for you because of pre-existing conditions.
I was wondering about that.
Yeah, so a lot of companies now that offer annuities, They offer life insurance, but they have riders there available to take care of critical care. Because you could spend down a significant amount of your resources if you're not careful. And that is why we always, I ask the new clients coming in, do we have aging parents? Do we have dependent kids? What we need to do is have predictable income. We got Social Security, hopefully that'll be around. Put aside funds to give you guaranteed income, all right? You need all the resources. And let me add this too. You cannot charge your retirement. You have to purchase your retirement. And if your parents are aging, set aside and you have to prioritize a long-term care program for them or some type of insurance that offer critical care, as well as for yourself. Because we mentioned the fact that 29% of married couples, there's an opportunity there to live beyond age 95. There's also non-traditional care. What do you think about that, Carolyn?
Well, you know, some older adults are considering things like taking in boarders, and the boarders can help with the shopping and repairs, or they can help with, or they rely on monitoring devices or delivery services.
Exactly. We got care from afar. You mentioned the fact that you participated, you were in Maryland, and your parents in North Carolina. Adult children are more mobile, has led to more long-distance caregivers.
That's true. So children do what they can from hundreds of miles away, but checking references for an aide, managing the bills, or arranging grocery deliveries. But I know as well as myself, they often feel guilty not being there to take a parent to the doctor.
Exactly.
And uncertain about how someone else is really doing.
And technology, of course, plays a big role to alert remote caregivers to emergencies and keep families in touch. But what is amazing, it doesn't take place for someone to make sure there's food in that refrigerator. Technology is nice, it's wonderful. However, we got to, again, look at the geriatric care managers, often nurses and social workers. Managed care locally can cost anywhere between $50 and, $200 an hour. That is huge.
And while we're on that topic, technology can do a lot, but it cannot take care of that human touch.
Exactly.
That voice, someone checking on you to see how you're doing. So technology is very helpful.
Right.
But it's not the end all.
It doesn't end all. And let me pivot for 1 minute. I talked about long-term care. I think our viewers need to know that we have a brochure that's available for you, which covers the cost of long-term care. And also, it talks about how to protect your assets. You can email us at freeman@justaskfreeman.com.